I said, no, you can't come in the room. You know, they just want to stage manage this.
When's the documentary?
It'll be a long time. They're documenting all of our. We're the most transparent health financing system probably in the world. We have all our payments by member number and category on the web. Every denial claim like us on the web. We are a defined benefit menu. We pay for specific categories of health need. While we're still small, we load it into everyday emergencies. So that by this time, for the same $100 a year that people paid when we began, they're now well covered for broken bones, ambulance rides, emergency stitches, burns, certain minor surgeries, part of the emergency room access, and a little bit of dental. And we have accumulated so much money now, it's begun to get around through the internet. We have a website, and the people are joining from all over the country. We have members in 26 states now. We're getting so much money now that we are having to scramble to get it back out there, not only to have more categories of payments, but to start a loan fund for organic local agriculture, foundation of human health.
Okay, I'm going to put them into a brief, and now I put someone else onto a
holistic attitude toward health. And we have a loan fund for local healers, affiliated with the fund, to help them with their facilities, their training. Yeah. Sure, yeah.
Do you have any buildings you've created, or do you have any plans like to expand into daycare type work or elder care in conjunction with massage?
Well, anything. We started the massage army a couple of years ago. There's a massage school in Italy with so many massage therapists that we the massage army, and we give away free massage. We pay the massage like a dozen massage therapists to give away massages. We could do anything with our money, and the members have a say in how this develops.
Well, are you the control aspect of it? They're trying to bust you on control. It's a control question, isn't it?
Well, it's the revolving door between regulation and industry. I've done a web search about people who have contacted us. And I know when they were married and the schools they went to and what their passions are. It's all on the web. And also what law firms they work for, HMOs were their clients. Which is not answering your question.
Well, I guess kind of a futuristic question, but I'm envisioning the need to like dismantle Medicaid eventually and get it down to the local level. People can decide what therapies they want and don't want, and override state regs, and that gets into like the Helsinki Agreement and what rights we have as individuals to access therapies that are currently in Mexico and Germany and Switzerland and all that stuff. Is that kind of what this whole thing is about with the state, the control of your autonomy, and they want?
Well, so far, I think it has more to do directly with the domination of health financing by HMOs, private sector.
You're starting to take part of the pie.
You're
starting to take part of the pie.
Yeah.
Exactly. And we're already making a dent because more people are able to buy a higher deductible plan at less cost. We fill in the blend because we pay from the first dollar with no deductible in each of these categories that are currently covered.
So do you do any chronic, any stuff for chronic
Not yet.
diseases?
We're not yet able
They're
to.
all on the emergency side.
That'll be later. It's still loaded on emergencies.
Because you don't have any admissions criteria, right? That's
Right. We are what's called a community rating. Rather than saying how old are you, what diseases have you had, and what diseases have your family members had, and what's your ethnicity, and all those different things that are asked. We don't ask. We just say, what's your name, address, phone number, your email. We like to send a message once a month. And do you have any other health insurance? And let's name them. Most of our members have nothing else.
That's for $100 a month, Paul?
$100 a year.
A year.
Yeah, yeah.
What, that's what you charge?
That's what we charge, $100 a year.
No wonder they want to bust you.
Yeah. You know what, we're gonna start a free clinic, that's next on the agenda, a free medical clinic, a free dental clinic. With a good pile of money as a grassroots organization goes. I never thought I would be managing, I'm the treasurer and office manager.
Oh my God.
Yeah.
You want to give him $100?
Well, I know Paul, I'd give him $100.
Right. Thank you so much. What would we give you something in exchange? Okay, I guess I have to, I think you were.
Could you just sketch out how this is all connected with the Ithaca dollars?
Yeah, we accepted, thank you for asking a very basic question. We accepted Ithaca HOURS for part of the membership fee. So I guess that's where I began. That's where I began talking about the need to connect Ithaca HOURS to more and more basic services. And before half of you got in here, I was saying that we're really proud that food is our basic category, the largest single category. And people can pay rent with Ithaca HOURS, people can get medical care with Ithaca HOURS, and this health insurance system. So people can pay 25% of the $100 membership fee to HOURS. Businesses are enrolling employees in the service sector. Nobody's got health insurance, and so there's a special $80 per year fee for those people. And businesses can pay in 50% of the hours. We have a taqueria, which put Taco Bell out of business in the downtown area. Very proud of that. In fact, McDonald's left the Commons, left our downtown, and was replaced by a vegan deli. As soon as Viva Taqueria started, across the street from Taco Bell and Pizza Hut, which shared a sterile environment together, and the funky Viva Taqueria and all the people with hair clips and tattoos were dishing out really good stuff across the street. Taco Bell and Pizza Hut were gone. So
How long?
Huh?
How long?
Oh, it was just like a couple months.
Recently? Just this?
You have to see that grease writing on the wall.
Sure, that's
That is. Oh, this happened in Ithaca probably 9 years ago.
Is your coverage in Canada?
We have one Canadian member.
You got two now.
Yes, which of you come from a civilization? Which of you are here from a civilization? You are from a civilization.
What's a civilization?
It's a place where
Yeah,
if
healthcare.
someone is ill,
You
they
actually
are
take care of
not,
them.
they're not trampled underfoot, but they're assisted. It's a right
civilization north of the
Paul,
in that sense.
sorry,
Yes.
sorry to break it up, but as a group, I suppose that you're working with, in a strategic sense, with a sense of priorities in terms of healthcare, and have you identified, first, second, third, a whole range of healthcare priorities, which could be anything from elder care to daycare to, there's a whole strategic sense of to diet to massage to, it's all included, but so have you guys come up with a sense of a holistic health plan with priorities?
Well, we certainly have a sense of what our idea of a holistic health plan is, a holistic city in which to be healthy. We are proceeding based on what we can do, and while we prefer preventive care, we, as I've said, are loading our plan at this time into everyday emergencies. And whether you meditate and are centered, eat right, somebody who doesn't meditate is not centered, eat right, that can come along and knock you past. And then you have to have broken bones mended with stitches. People are walking on my housemaid is one of the most Gandhian persons I've ever met. And crossing the street after meditating in the gorge and came out and was nearly crushed like a bug and incurred $65,000 medical costs. So it doesn't matter. That's a roundabout way of saying, everyday emergencies are relevant to everybody, and so that is something we have given attention to. To begin, it also matches our initial capability to pay because it's non-elective care. We're not yet able to pay for much elective care, though we give a rebate on dental exams. When the dentist will give a 10% discount to a health fund member, we will give them back some of that.
Just a quick question on what you found average payouts to be like.
Yeah. Good question also, we're developing our own actuarial experience. We're just a bunch of people who really don't know about the details of this field. We learn as we go. We chart of the frequency and the amplitude in each category of what we have paid. And so we develop an understanding of, and we become a little more bold. Okay, let's raise broken bones from $2,000 maximum income to $2,500, and now it's $2,750. We just paid $3,000 last month for somebody who had broken bone and stitches together. We just paid $1,500 2 weeks ago for emergency appendectomy, which cost $1,525.
I have actually two questions. The first is, have you guys gotten health providers, either holistic or more traditional, to accept Ithaca HOURS in payment?
Oh yeah, there's a list of about 120 in Ithaca.
Excellent.
Actually, who are affiliated with the Health Fund, and probably 225 health providers all together who are on the Ithaca HOURS list.
That's great.
We have a couple of dentists. There's one dentist accepting 100% of the hours. The medical center, as I mentioned, accepts the hours. Not too many doctors yet, MDs yet.
And then you have,
There was one eye doctor who accepted one Ithaca hour per hour of his work. The spirit of the system.
sure. Excellent. So the other question relates to the actuarial side. Have you guys, or are you considering that people who are living holistically and wholly and caring more for their bodies ahead of time are actually going to be less of a drain on the traditional healthcare system than folks who aren't? And so you can start to say, as you're buying, you're essentially I don't exactly know all the terms, but you're a preferred group, so that you're able to achieve better rates because you can show a better general health within the community, something along those lines.
That's among the many good questions that we can begin to ask. So far, we have preferred what's called community rating, where the more healthy will subsidize the less healthy.
I understand.
And of course, our culture encourages us to be unhealthy in so many ways, or imposes ill health on us, even if we are trying to be healthy. We walk through cities and breathe bad air, water, good food. Healthy food is expensive. So, regardless of our best efforts.
Sure.
But we're so far attracted to the idea of community rating rather than as the insurance industry itself does, peels off the less healthy people and wants to keep them away.
Right. Oh, my suggestion was more that you're going to have an overall, even with the unhealthy people as a community, you're going to have less of a drag on the, traditionally thinking, less of a drag on the system because you're going to have fewer incidents of all the sort of more long-term debilitating problems. Yeah, I hope to see that.
Yeah.
Do you have a maximum amount per type of emergency?
We do. You're asking me the right question. We do call and response. This is, and I do not have enough of these, but the website has got all this on it. It's Ithaca Health, ITHACA Health.org. This is the current list of what we cover and the maximum amount in each category.
Go passing one around.
That's a good idea. Broken bones, burns, emergency appendectomy,
How much is that?
stitches, ambulance drives, huh?
How much is that to do?
The appendectomy, $1,500. As I just said, we paid that a couple weeks ago, and the total procedure was $25.
Really?
Yeah.
That sounds like quite a lot.
Yeah,
How much are you getting after him? Can you talk about the interaction between the local?
the fellow behind you there was,
Thanks. Paul, is there any required or encouraged educational component about maintaining one's health as a part of your program?
well, it could be done. In Ithaca, we're a very holistic community. In fact, when I went to the medical center, I had several things leverage, and I knew that it was sitting there. One was that they had a big fight with Blue Cross Blue Shield. Another was that the study had come out saying that 40% of Americans relied on some kind of a holistic therapy, and that Ithaca was so full of holistic healers, and that people were so much preferring to go that route rather than pills and surgery, that I could go to the Medical Center and say, we would really like to invite you to help us pioneer this health plan, and it'll help low-income people to pay their bills readily. Of course, to be part of this pioneering process with us, you would need. So we had several meetings, and our local banker, the credit union, which accepts Ithaca HOURS also, for 100% of bank fees, and also for part of loan repayment, and has received our largest loan so far, $30,000 itself. They met with the medical center folks. I met with them when we got together and talked it through, and now the health fund will pay some of what we are obligated to pay on behalf of our members to the medical center and with Ithaca HOURS. And people in general all over town just go there.
On the upper end of volume.
All right, go back there. All right. Okay. Now, so I guess I answered. I guess I did. And then you were next.
I wondered if you could speak about the local versus non-local component, because you said you have people from around the country who are working on that. I'm wondering how that works out for you to have paying money to people in other states and not having a relationship, and if there's any issues about do you have any health care providers who are out of Ithaca?
We make payments anywhere in the world with any health provider. Doesn't matter where someone lives or where they travel. And we have made some payments far beyond Ithaca. What we're doing is trying to set a model here of local and regional community-based self-insuring. And at the same time, in order to accelerate our scale and to accelerate the proof that this system can work, we are inviting people from well beyond Ithaca to join. They get the benefit of payment for these categories. People in Ithaca get the special benefit of discounts with local health providers, and if we start a clinic, a medical and or dental clinic, they would have greater access to that. We don't want to become the Godzilla of community-based health financing. There are 44 million Americans with no health insurance. If they each paid $100 a year, we would have $4.4 billion a year. We would make Cornell University look like a haberdasher. And people would not be, so we don't want that to happen. We'd have to have like 50-story building, and you'd have people demanding better air conditioning and a new chair this year. In fact, in our bylaws, we require that the maximum payment to any employee, no matter how big we get, will be 2 times the livable wage in Ithaca, New York, as defined by our local credit union. Just about $18 an hour now. We want people who are excited to get up in the morning to put their great skills to work for the benefit of the community.
Could you give that number again?
2 times the livable wage, about $18.
That's the limit.
That's the maximum limit for administrative staff, for the health fund. I volunteered my effort for the first 6 years. I had a couple small grants. And then last year, the board offered me $10 an hour. I agreed to accept 7 because I thought that was what. And this year, I'm accepting $10 an hour for the work. And I accept Ithaca HOURS as part of my pay. So, I think you're right.
I was really following on from that. The administrative costs are all covered by the premium, the $100 premium, and about what ratio, what percentage are your overhead costs?
I decided I would not accept more than 8% in a given month of our income. I think
for
that's
claims processing and all this kind of stuff.
Yeah, right, for all that stuff. I think that's actually a higher percent than I hope we will level off at, if we ever level off. But each year we've been bringing more money in per month. The first year, the average income was maybe $600 a month. And the second year even less, because went through the pool of people most motivated in the first year, and then talking to the next tier of people about it. So the first people who joined because it was a noble idea, and then you started to you got through those people, and you had to start getting people in it because they could see some more immediate benefit, and that was hard in the second year. And then we got a grant, which enabled a $10,000 grant, which enabled us to start to make a modest payment for broken bones. So some people came in, and now people are calling from trailer parks. People are calling from, there's all kinds of stories. You pick up the phone, and hang up the phone after talking with people about some terrible misery that they have to deal with. This is incredible. In the United States of America, you just run down the street, smash windows. This is better, I think, approach than smashing windows. And I think that you were next.
Do you pay the provider, or do you pay the member?
We will repay the member if they have paid. If the bill is sent directly to us, we will pay.
Oh, so you have
we'll pay whoever sends the bill to us.
Okay, but the providers are willing to send the bill. I mean, I suppose it doesn't matter.
They want money.
Right. Right. I have another question too about Medicare, acting as the Medicare supplement.
We've had a couple Medicare people in the system, and in fact, they had a copay that Medicare didn't cover. We paid it something or other. And we accept local currency from beyond Ithaca. We'll take 5% local currency from whatever community you come from. And we'll make it work. As one of our early retailers in the Ithaca HOURS system said, yen, marks, dollars, Ithaca HOURS, I don't care, give me money, I'll make it work.
How about pharmacies? I'm sorry.
Don't have them yet. They're mainly chain. There is a local chain, and I've talked with them, and they've been helpful, but not yet. We don't have that. Yeah.
Well, she just asked one of the questions. The other one, when the $100 a year is per individual as opposed to per family, right?
Right.
Okay.
And it's $50 a year per adult, $75 a year for a partner. People can join as a couple for $175 a year. We don't ask if you're married or not. We don't ask your genders, anything like that, your partners. And per child, it's $50 a year.
Okay.
Yeah. It's become, for the uninsured in this country, it has become the best deal in the country and gets better all the time, whereas with an HMO, you're paying a higher premium pretty much every year, and they're resisting paying you more every year. We, for the same $100, and in fact, because of inflation, that initial $100 is worth less than it was in 1997. You're getting greater coverage.
Are you working with, sorry, I didn't mean to interrupt.
As emergency care is so expensive to distribute, are you contacting the local hospitals for contribution? I mean, you're providing real money to them that doesn't have to come out of their budget.
Well, they're giving us a discount, and we have an ambulance service which also gives a discount and accepts Ithaca HOURS.
I was wondering, are you working with other groups in the state or in the country that are doing similar things to you? Is there a network of people?
Well, we looked around. I did a web search. I keep looking around the web and haven't found anything yet in this country that's I found that there's a region in Uganda, something similar, and a little town in rural China, which has something similar. Now, the Canadian single-payer system, we learned a couple of years after we started, somebody out in Washington wrote an article about the single-payer system, about the Canadian health plan. And it started with a farm town of 15,000 people in Saskatchewan, which said, well, you know, we're just all family here, and we're just not going to let each other die in the street, so we're going to create our own thing here. And it worked so well that within 13 years, it had become a provincial system throughout Saskatchewan. And only 9 years after that, by 1971, it became a national plan. And the article concluded that Ithaca, New York is now doing that for the United States. That's maybe overreaching. We would like to see that day come. We have a good start. It's still very small. It's a minor medical plan. It's not a major medical plan. But we like to think that if we survive regulation here in New York State, that we will. We brought in $300,000. It's like you can spend that much in one day, on a bad day, for one person. And it's taken us a long time to bring that money together, but it's coming in faster than ever before now. But because we have a defined benefit menu and we parcel it out in this way, it provides really good coverage for this concern for everyday emergencies that people generally would have. A very, very small amount of money, like $8 a month. And that, as I say, as more people join, we just keep adding to that menu of coverage. And we're bringing in, first year we're bringing, I'm going to just go through this, we're bringing in about $600 a month. Second year, maybe $300 a month. Third year, about $1,500 a month. Fourth year, about $2,500 a month. The fifth year, $3,500 a month. This is roughly accurate. And the sixth year, $4,500 a month. And this year, it's right now, the first half of the year, it's like $7,000 a month. 7 years. It's just a lot of talking.
In his first.
I'm just wondering about, you must maintain a reserve balance in your fund for.
Yeah.
So how do you set that, and then how are you investing the balance?
All these are good questions. It just shows that any of you are capable of starting.
We actually have a small one in this one.
Oh, you do?
Yeah.
Well,
It's just within the Hawthorne Valley Association, but
is that a neighborhood association?
it's a not-for-profit that has Hawthorne Valley Farm, Hawthorne Valley School, Visiting Students Program, Donors Press, and on and on. And so the employees are getting full health coverage, and we're paying a very high deductible outside premium, and then we have what we call our social fund, because we were told we're not allowed to call it a self-insurance fund because we're not supposed to have our own insurance company, and out of that fund, we're paying all the complementary cares that we all, so we can all have our freedom of medical choice. And we maintain what we think is a 2-year fund balance, so that if we actually had, based on our average experience, if we actually had a really bad year, we'd actually still be able to pay everything out of it. And I'm just wondering how you set yours, because clearly we also need to expand ours beyond the employees of Hawthorne Valley Association to, I would say, everyone in the community, because our alternative therapies, our complementary medicines and complementary therapies are finding it very hard to do business, and we're in jeopardy of losing them, and quite frankly, that's not an alternative to me.
Why are they finding it hard to do business? What do you mean by that?
Well, they're operating in this system that's run by the regular insurance companies, and it makes it very hard for them to. Yeah, it's just very hard for them to exist in that system.
Well, that's what I was asking earlier. I mean, about freedom of choice and therapies and what's covered and what isn't. Because, people that are interested in, there's a group called the International Council for Health Freedom, which is a nationwide, it's an international organization actually. They're extremely political. And anything of this nature where you have state intervention, a friend of mine is the president of that thing, and he would jump on this in a heartbeat. If there's any PR, and if people are not organized politically, I mean, they overturned the laws in New York in 6 months. You probably know that. When they busted Atkins, they came in. Oh yeah, they took a picture of a grandmother with an IV, and they said he was a fraud and a quack and a charlatan, and they stripped him of his medical license. You never hear about this stuff here, but. They took a picture of this elderly woman. They said he was ripping off the elderly with unapproved remedies, quote unquote. And then they kick doors in. They come in with machine guns and all. This goes on all the time here. I mean, not daily, but it happens frequently enough to. People should be alarmed and connecting with other groups.
That group?
It's called the International Council for Health Freedom, and there's a printout downstairs regarding that. And it's an extremely political group. He'll write about raids on clinics, harassment of people like you're undergoing at this point, and they can get in touch with people around the country in a heartbeat. And there's all kinds of people there that are like contesting immunizations, the invasion of privacy, and in terms of injections with drugs and denial of therapies, and particularly things like this, because they don't want, well, as you know, their money system messed with in any way. But if you can hook up with these folks, you may prevent things from occurring in the first place.
Right, well, I was talking about that.
Yeah,
the name of the
this guy is like, he's been in this 40 years. It's extremely politically active and aware. And he would interview, he would put it in his paper and everything. Anything of this nature, it'd be out.
Right. Yeah, we need allies at this
You need
time.
it. You need.
In the back.
I'm sorry, I only came in about 15 minutes ago, and you may have said it at the beginning, but would you give a quick scenario of working poor in Brooklyn and in East Harlem who would like to participate in this plan? Like, what would have to be on the ground? They don't have Ithaca dollars or access to
Well, we
them.
accept U.S. dollars.
They would simply pay these prices, and they
I'm
would
sorry,
get...
I'm selling out.
It's important, I think it's...
We have members in New York
Be
City.
isolated, so you have members.
Yep.
And then they would redeem emergency, it's just emergency.
Yeah,
healthcare.
I have this literature, and then again, for anybody who's come in very recently, the website is Ithaca Health. Here, we'll move one around that side. Down the center aisle.
Can you also answer his question about
This is
what?
a,
Yeah, and about the reserve fund.
Yeah.
Let me finish that. He asked about the reserve fund. We've brought in $300,000. We've paid out $50,000. The cushion gets bigger. And there are two functions of health insurance. One is to assure people that if something happened, they would be paid. The second function is to actually pay. And so we want, of course, to maximize our capacity to cover things that people dread, and then also to maximize the amount that we will pay. So balancing those two requires us to maintain an ever larger reserve fund. I think in the last few months we've gotten so much money. The wave has hit the shore, and we need to scramble to expand our menu of coverage.
What do you want to know about investing in?
And we have our money in CDs. And we're looking to start a clinic. It's all liquid, very liquid stuff. Investing, we're wary of investing beyond, but I'll be talking at the panel discussion after this hour about slow food, slow money, and I have put together the basis for what I call the whole Ithaca Stock Exchange, WISEY, gathering capital of all different kinds for eco-development. And it would rather see the money of the Ithaca Health Fund invested locally. And as I mentioned earlier, we're starting a loan fund, revolving loan fund within the health fund for local organic farms and also for the healers affiliated with our system, with our health fund, to help them with facilities, equipment, and training. That's the kind of investment. There's margins of percent margins are less urgent to us at this stage. Though if we ended up barrels of money every month, then we would have to look more closely at how to put it to work. Preference would be put to work within the region. Yeah.
When you all go to Albany, are you going to post the results or the outcome and all of that on your website?
Oh yeah.
That'd be interesting.
We've gotten letters of endorsement from the Chamber of Commerce, of which we are a member, from the chair of the New York State Senate Insurance Committee, from our state assemblywoman, from our mayor, who declared Ithaca Health Fund Day this last May 11th. And yet the insurance department is like Frankenstein.
But you know, in insurance regulation, the word usage of having insurance premiums is one thing that affects insurance companies. And usually the word usage is usually cost savings. It's not directly saying that we accept premiums, and because in order to accept premiums, you have to meet a very narrow criteria, and that's probably what's going to be approached with you all in Albany. One, you need to find out what the criteria is and whether you can meet it or not to be considered an insurance per se company, because I would love to see you all be considered a company as opposed to the cost savings, because then you're delivering a product directly to the people that need it, that need that delivery, which is the lower income, smaller businesses, and that opens the door very wide for a whole lot of other, like in Philadelphia and other areas.
Yeah, I think you're right. To that extent, they are regarding us as the germ of a great threat.
Right.
Yeah. That's important.
This is related to a couple of the questions that came just a few before about complementary and holistic care. I assume that is it true that Ithaca dollars are accepted by a lot of practitioners in Ithaca?
Oh yeah, I think about 225 or so, and half of them are affiliated with the health fund, giving discounts as well as accepting.
So have you thought about doing insurance for that sort of care? I mean, that seems like a natural possibility in this kind of organization. You can go there and get it covered by this insurance.
While we're still small, as I mentioned, we have to load it into non-elective emergency care. We do have what's called a 510 plan. If you go to somebody like a chiropractor, massage, and so forth, acupuncture, 10 times, if they donate the 5th or earlier treatment, the health fund will donate the 10th treatment. And you can combine that with your basic 10% discount, if that's the discount, someone would get a 28% discount over 10 visits. But we very much prefer that kind of preventive stuff, and I think the likelier way that we will be able to contribute to that will be through the clinic system. And we already have a bunch of these people saying, hey, I'm signing up for 2-4 hours a month. Even MDs are saying, yeah, you start that clinic, I'll be there for 2 hours a month. We have an MD on our board. We have a woman who handles the insurance paperwork for a local MD. We have a massage therapist, a yoga guy. We have a nurse clinician. We have people with that kind of background, largely a photographer, and a social entrepreneur.
Paul, there's a question behind you.
Yes.
Can you give some idea of what the regulatory obstacles are, what the assault is going to be? I mean, I have no idea. I'm sure it's huge, but I have no idea what it is.
In New York State, they very tightly regulate. And we have said, we welcome your inquiry. You have a legitimate right to regulate this, because the more terrible the situation becomes, the more you have fly-by-night. Hey, $89 a month and we'll cover your whole family for everything. That stuff is going on. And so we've said, you have a we've engaged them very constructively.
But what are the ways
And so,
you
that's
expect
right.
them?
Right. So that in New York State, in order to be an insurer, you've got to put your X million dollars on the table and cover mandated. You've got to cover just a huge variety of things, and of course you'll have to have your 20-story building and 300 employees. And that's if you are regulated. Now, there is, you can be exempt from being regulated by the New York State Insurance Department if you are a 501c3, which is not primarily engaged in health insurance, which provides this as a benefit to your members. You can insure a maximum of 1,500 people. So we would know we were going to hit that maximum anyway, so we devised special legislation to enable us under strict conditions that we ourselves are defining, because we want to set a standard which is way ahead of the HMOs for accountability. We want to have our maximum of 10,000. I think with 10,000, I've said, if you take half the people in our county, that's 50,000 people. If they each pitch in $100 a year, that's $5 million a year. And with $5 million a year, you can socialize dental care.
Yeah.
You can socialize a lot of medical care from below. Why wait? But that tradition of putting small amounts of money together to do big things is not so strong in our country now. And that's what we're all about here. The different initiatives we take under the headline of currency. Yes.
I have a few technical questions. First, as you know, if you don't have insurance and you go to a hospital and charge you, most hospitals charge you a much higher rate if you are covered with some form of insurance. And I'm wondering whether you issue a card, something that you can go to your emergency room, say I'm covered by Ithaca insurance or whatever you call yourselves, and that would give you that lower rates right off the top. It would be like that issue is covered, because the difference could be several hundred%. There's a lot of articles in the New York Times about it. We see in the Wall Street Journal about this.
A little louder.
They did that tax legislation.
Yeah, it's the case that the Ithaca Health Fund, especially when we're insuring people well beyond Ithaca, is taking the full hit. Because we're not insured, we're not considered an insurance company. We don't have covenants with medical centers or doctors out there. We're not a preferred provider organization. As I said, we make payments with any health provider anywhere in the world. So we are taking the full hit out there. in Ithaca, we have agreements and covenants with Ithaca Medical Center, Ithaca Orthopedic, 20% discount with them and with others. So we are getting a cut from the full price. Yeah.
This has obviously grown past Ithaca and will in the future, but my question is, do you think this would have been as successful if it came before your work with Currency? How do you think, because it seems from the outside you've changed culture in your community through the Currency.
You're completely right. Ithaca, the groundwork for Ithaca Hours was laid by the existence of a thriving farmers market, credit union, food co-op, and a counterculture. We have 7 full-time music recording studios in Ithaca. Everybody is burning a CD. And there's concerts. You have to decide every day among concerts. It's a very lively town. All kinds of stuff going on. You go to ithacanews.org. I publish an online newsletter collage of Ithaca activism. And I collect emails, like some people collect matchbooks. And I have 7,700 local emails, and that's a large part of the community. And so that groundwork was laid for Ithaca Hours by those programs. And then Ithaca Hours further expanded the network, made explicit that network in the marketplace. And personally, because of my work with Ithaca Hours, people were much more ready to give me $100 than they otherwise would have. And yes.
Yeah, I'm particularly interested in the difference between projects and movements. And I wondered if you thought about tithing or having some kind of a percentage that goes to healthcare reform, you know, to the national movement. Those people often are mostly, those organizations are mostly exhausted caregivers already. They're in the health world and they look so tired. I wondered, I'm just trying to think of how we could infuse that movement. And one is the idea that people who have a decent health care plan could donate $100 a year to this kind of a thing. But it would matter that your Ithaca Health in some way was funding organizing other places in addition to your own.
I think that we are contributing to a national movement insofar as, and we highly commend the efforts to beat fists on the heavy iron gates of state and national governments. Say, you know, hey, give us the money. Don't kill people elsewhere with the money. Don't destroy the planet with the money. Help us heal each other. And that's urgent. The legislative approach is essential. And I think personally, I and others have affiliated with Ithaca Health Fund because we see that that is, though it is necessary by itself, it's going to be stonewalled. You could have a 10 million suffering American march on Washington, D.C. You could have all the 44 million Americans march on Washington, D.C. Just devour the place. It wouldn't be a heavy load. And there would be...
We should bring our stretchers.
That's right, bring stretchers and crutches and everything. And there would be, you'd have Time magazine on the cover, you know, and the Wall Street Journal would say that 300,000 people were there. And there would be committees, and there would be the president. So he cared, and everything would happen except the legislation. And even if it did, if you flip the switch overnight and say, okay, now we have a single-payer system, the corporate sector would legislate itself out of reach of that, and the middle class, such as it remains, would carry that burden.
That's right.
It'd just be added. We're not only going to have, you're going to have your butter now, but you still have your guns, and you're going to crush you. And so that's why we feel that this approach is an essential part of that larger campaign. We share an office with renegade organizations on the second floor of an anarchist bookstore. It's a beautiful bookstore. And across the aisle is the health Action Network. And if they ask us for some money, we might give them some, but they are doing well enough. Each of them has insurance. So it's like so I think that's what we contribute right now.
I hate to interrupt here, but I think we're out of time. So.
It's still 11 o'clock. We have 10 minutes?
Session's supposed to end at 10:45.
All right, I want to summarize,
I
I have a book on how to start local currency in the bookstore. And a video also which shows Ithaca HOURS as seen on national, international, and regional television. I have a few of these. I apologize. I had another pile that was not included in the shopping bag. And then I have some of these for those of you who don't get this. This is some links to the various things that I've been involved with.
Are those available on your website?
Yeah, but IthacaHealth.org will get you a huge amount.